All right, good morning, you guys. It is time for your health check. Hey, allergy sufferers out there, if you are experiencing itchy, watery eyes, maybe a little sneezing, some runny nose, sore throat, there is definitely a reason why. Joining me to talk through this, Dr. Kirk Waibel from Aspire Allergy. Good morning to you.
Good morning. Thank you for having me.
So, okay, the allergy forecast for today and tomorrow, I looked at it. It's wild. What is going on out there?
We definitely have some wild weather in Dallas, and unfortunately for allergy sufferers, they have no reprieve during the winter. Specifically, mountain cedar is peaking this time of year, and it really is a scourge for patients. It goes to super high counts, and it causes all those symptoms you described.
Oh my gosh, this video we're looking at is so gnarly. And Dr. Waibel, like even with the rain we've been experiencing and the colder weather, because sometimes I feel like that usually helps the allergies to subside a little bit.
Yeah, definitely the cedar counts are very weather dependent. So as you mentioned, the cold unfortunately causes the pollen release. On the flip side, when you have some rain and moisture in the air, it pushes the counts down. So if you have sort of a trifecta of very dry weather, very cold weather, lots of wind going on, you're going to get those high counts.
Okay, that's, yeah, exactly what we've had. And a lot of people out there start to feel some of the symptoms that I talked about, and they think, do I have COVID-19? Could this just be allergies? Because there are overlapping symptoms. So I'm sure this can be confusing for a lot of people. Can you clear this up for us?
Yeah, it's definitely confusing. And of course, when patients are having some of these overlapping symptoms you see there, such as they have nasal congestion or a runny nose, they're worried. Those are family members, coworkers are worried as well. But certainly we worry about if there's a sudden loss of smell, they have fever, body aches. Those are not typical allergy symptoms. Often allergies are referred to as hay fever. There's actually no fever with allergies. So if you have a fever, we're definitely concerned. But certainly that quality of life, the inflammation you get from allergies can really make your body feel run down.
And then what's your best advice finally to attack allergies, both short and long term?
I think the first thing is just knowing, is this allergies or not? I mean, allergy diseases, specifically hay fever, affect at least 15% of the population, 40 million Americans. And so if they've never talked to their doctor about this or never talked about maybe seeing an allergist or getting testing to know what their allergies are and how they can treat them, I think that's one of the first steps. Certainly, there are some simple things you can do right up front. Over-the-counter medicines, oral antihistamines, nasal steroids. Those are some of the first-line medicines patients can reach for right away. But certainly discussing with their provider, when is the right time to see an allergist, because we can do a lot more things besides medicines. We can really address the root cause to really maybe wrap those allergies up and make them go away for good.
Oh, doesn't that sound lovely? Okay, Dr. Waibel, thank you so much for your time this morning. Hope that was helpful to a lot of our viewers out there.
Thank you very much.